Dr. Joseph, Dr. Monica, thank you guys for coming on.
Thank you. Thanks for
really
having us.
appreciate you both being here. Excited to have you guys on because I visited your space recently, like instantly understood you guys are doing something completely different in dentistry. So want to explore that, want to explore you guys opening a practice together, right? The challenges that come with that and really just kind of dive into all of it and hear your story. So before we start and dive into kind of the details, let's hear how it began, right? How'd you guys meet? How'd you guys get into dentistry together? Like tell us the story, whichever one of you wants to start.
Yeah, so we actually met in dental school. We were in the same class, Howard University class of 2019. Started dating shortly after the first year of dental school. Dental school's 4 years. And then, went through dental school, graduated. I went to my 1-year residency in Brooklyn, New York, and she wasn't too far away for hers in Newark.
Okay, yeah.
And that was the year of COVID, the 2020 year. So, things were socially and I guess you could say professionally, like changed a little bit. Like our residency was cut short as far as dental goes. We were doing a lot of stuff in the hospital, running blood labs and stuff like that, unrelated to what you do in normal everyday dentistry. And I know part of my story overlaps with hers in that she had a family health issue crisis going on that kind of had us separated a little bit for that period of time. But once we got married, we moved in together into the DC area where I'm from, and then moved to Florida about 8 months after, working in different associate jobs, realizing that we wanted to open something different, something unique, special, kind of catered to the patients that we end up wanting to treat. And after 2 years of working here in Florida, out of the 3 years we've been here, we decided to move forward and do our startup, which is what you saw.
I love
basically.
that.
Yeah.
So I have 3 questions right out of the gate. So they're flying through my head.
Good.
COVID, you guys were in different cities, obviously not terribly far away.
It's like 40 minutes or so.
But did that limit your guys being in healthcare, being like how much you saw each other during that year? I mean, imagine being in residency, you're busy, you don't live right next to each other. So obviously that's going to limit it regardless, but that limit it further?
Oh, for sure. So once COVID hit, it was just like, obviously everybody was like scrambling. And then being in the Northeast during that time, like was so different than being in Florida from like friends that I heard. And like everyone, not that it was taken lightly in Florida. It was just like the mindset was a little different. It was easier to like be outside and, it was easier to not have to like quarantine, I guess.
Sure.
So when he was talking about the health crisis thing, so my mom was re-diagnosed with stage 3 pancreatic cancer, like for the second time during COVID. So it was like hard for me to be able to be like, oh, I'm going to come see you. Cause if you get like exposed, like my mom lived in South Jersey. So I was like, then I won't be able to see my mom. Like I needed to like, so we really did social distance a ton because I was like, I can't risk getting anything from you because I want to go see my mom,
Yeah.
So like I was living in a mask with, in the house with my mom, but either way.
And was she undergoing treatment at the time?
Yeah, she was undergoing treatment. Like me and my sister would like back and forth, like take her to like chemo, all of us wearing masks in the car, like not being able to like go into the treatments with her because she had to do them all by herself. Like, and she could barely like walk at that point. So it was just like, it was rough. Like it was horrible.
Yeah. And somebody with a compromised immune system, like that's the real deal. My dad underwent a stem cell transplant for non-Hodgkin's lymphoma. And they effectively beforehand, like just wreck your immune system.
Oh, yeah.
And when he was traveling back, he got a tooth infection, almost took him out. Like, I mean, just a simple, tooth infection. So I get that, obviously with your mom undergoing chemo, that's it's important. So the second question is that you mentioned residency kind of being cut short. Did they just kind of like give you like, here's you're done, you're good to go? Or like, do you have to come back? Like how did that work?
Not quite. I mean, cut short as in up until COVID, we were doing like 12 hours of dentistry, extractions, fillings, crowns, whatever we want more training in. When COVID came in, completely shut down and only emergencies. So really the couple days a week you'd see patients, you just take them out of pain by, doing the first part of a root canal or an extraction. So any restorative, cosmetic, ortho, anything specialty you wanted to do, you didn't really do much of until like the last month again. And then that was it.
Do you think that shaped how you guys are building your practice now, like that experience, like doing it maybe differently than most people do in residency? And like, again, maybe not having the kind of the routine stuff and maybe seeing a little bit more of like, okay, it is just emergency dental. Has that had any influence on what you guys are doing?
Well, hospital dentistry in general is very different than like a private practice. It's really, you're seeing a lot of volume in a hospital type of setting. And there's not a lot of continuity of care a lot of the time, just because patients are coming in and out. There's a rotation of 20 residents in my program. So it's hard to kind of see the same patient sometimes. Sometimes they have to go to specialists. So things can kind of get lost through the cracks. Whereas in our office, everyone who comes to see us, usually it's the same. They're seeing one of us only.
Yeah.
You know, unless we send them out for something like kind of outside of our scope. But definitely the time we spend with our patients is definitely a lot longer than in a hospital setting. And I love my residency, by the way. It's a different way to practice. You can't really practice that way in a hospital.
Yeah.
But I think how we came to making Aura the way it is once we kind of really wanted to be in the wellness health, the health side of healthcare. She deep dived into biologic dentistry. I deep dived into physiologic and biologic dentistry, and we kind of merged the two together to create what it is. So we're very focused on airway, TMJ. How does someone's jaws and teeth develop as they're getting older? How does that affect the way they breathe? How does that affect the way they develop their growth patterns? All that stuff, as well as allergies to certain materials, pH testing, saliva testing, all the things that give us a bigger picture of what's going on in the body that the mouth is the window to.
I love that. It's very cool. We're going to dive more into that in just a few minutes. Before we do my third question, if you're open to it, I'd love to honor your mother and kind of hear her story. You know, it's challenging, right? I can't imagine. But if you're open to share it, I'd love to hear kind of your experience, her experience, and ultimately how that shaped you getting into healthcare and how you approach patients in healthcare.
Yeah, for sure. I always knew as a kid that I wanted to be some sort of doctor. Like it just always intrigued me. And I kind of dove down like the medical path, and I was like, no, this isn't really, I don't think I really want to do this. Like, I really don't want to be in a hospital. And then I shadowed and like dentists, and like they just seemed to be the happiest in healthcare. So I was like, oh, this seems like a good lifestyle. So I kind of like was going down like the normal, like, you know, Western medicine, like of dentistry trajectory. And then COVID hit. I think COVID was really the big driving force that made me like really question Western healthcare and like, okay, like, yes, like, great, we came up with a vaccine so quick, like, that's so cool, but I'm not getting a vaccine that has, like, no data. Like, absolutely not. I'm not injecting something that I have no clue what it's going to do to me. And, like, we were on the verge of, like, getting married and, like, wanting to start a family at some point, so I was just like, I'm not doing that. Yeah. And then even with my mom's story, she was diagnosed first when I was in dental school, like, kind of going into our fourth year. So it was 2018.
2018, okay.
Yeah. Like May of 2018. And like the week prior to her getting her diagnosis, she had gotten like her routine blood work and everything was great. Like she was healthy. So the end of that week, like that Thursday night, she FaceTimes me and I'm in dental school still. And like my sister and her are like, I don't know, like mom doesn't feel good. She like her stomach hurts. So I was like, okay, FaceTime me. And then her whole face was like yellow. Her eyes were yellow. I was like, there's something wrong with your liver. Like you have to go to the hospital right now. She's like, no, it's fine. She's like, I just got my blood work done. Everything's fine. I'm like, no, there's something wrong. You got to go. So she goes to the hospital. I had like this, like, I'll never forget it. I was sitting on the couch and I just had this like pit in my stomach. And I was like, there was something really bad about to happen. Yeah. Like I just felt it. And, the doctor was like, no, it's probably just like, you know, because she had gotten her gallbladder taken out 2 years prior to that. They were like, it could have been like some of the gallstones like fell and created a blockage, or it could be like hepatitis. It's fine, like hepatitis A from like food or something bad she ate. So then they see this like, you know, mass, and I'm like, great, like this is not a gallbladder stone, and this is not like a whatever. So anyway, she gets her diagnosis, stage 3 pancreatic cancer. She'd never been a smoker, never been a drinker, never ate anything like unhealthy, you know, was a hard worker. She didn't necessarily work out, but she was always moving around like all the time. And so it just didn't make any sense to me. And I was like, how could you've just told her she was healthy 5 days ago, and now she has the stage 3 pancreatic cancer diagnosis. Like it just made no sense to me. Obviously, like I went into fight or flight mode and just stayed there for like 3 years. Just kind of like watching her going in and out of treatments and like getting her surgery. And like, honestly, even after her surgery, my sister was the one that had to like take care of her, even though I'm the one in medical. I like couldn't bear to like clean her wounds, or like I was just like very traumatized by the whole thing.
Yeah.
And because my mom like never even had a cold growing up, like I've never even saw her get sick, so it was just like so weird to me to like she was like super mom, you know.
Yeah, you have this idea in your head that mom's invincible, right? Yeah. Oh.
So then like I see her kind of like going in and out of like the cancer treatments, and like the way the doctors are just like so like, oh, just get on this chemo, get on this radiation. And then there's like the way they talk to you, like there's like no hope that anything could even get better. And it's not like I get it, like you can't tell someone that they're going to be cured for life, but like I just felt like I was like, this just doesn't feel right, you know.
Yeah.
And then unfortunately she passed away 5 years ago in this June. But that's when I was just like, I was so like done with Western medicine. I was like, I don't trust you. You don't look for root causes. You don't try and fix problems. You just treat symptoms. And then whatever you're treating this symptom with, you put this patient on another medication, and now they have another symptom you have to treat. So this is not really like the vibe I'm going for. Like, I want to, like, I know we all have a time where we're, you know, is our end time, but I'd rather be on this earth and live in the most healthy state that I can, and just enjoy my time on earth, because we're not promised. Tomorrow's not promised.
Yeah.
So it's just, that's all that stuff kind of. And then COVID was like really the icing on the cake. That was like, I just don't trust Western medicine at all.
I think a lot of people had that shift, right? And myself included. And I already had my skepticisms, but it just seemed to really, there was something jarring about that whole experience that everybody's like, wait a second, something's not adding up here. Like, just doesn't, this approach isn't working. And since then, there's been a lot of positive changes, I think, and more practices like, and whether it's dentistry or other areas of healthcare, like you guys opening up, that are more, you know, forward focused and maybe a little bit more holistic, root cause oriented. Like, that stuff's great and fantastic. Going back to your mom, right? What do you wish had gone differently in the beginning, or maybe earlier on?
I wish we looked into alternative therapies sooner. Like, I wish we looked into like Gerson therapy and like Hope for Cancer in Mexico, and like before she was too weak. Because the second time around, because she got her surgery, and like the problem was she had to get chemo and radiation because they couldn't remove all of it. There was like some margins, like there wasn't clean margins. Had she been able to get all of it removed, then, you know, she probably would still be here today, but they couldn't. So, I do just wish we looked into alternative methods sooner, because once we started to kind of see, like, especially after COVID, because now her second diagnosis was in May of 2020. So she had like 8 months where she was like in remission. Well, she was never really in remission. It was just not really detectable. But that's probably something I wish, because like on like the spiritual level, she was like super strong in her faith, and like she was like, her spirit was great, you know, like she was like, this is like, it's okay. Like, even if this is the end for me, like I'm going to be in like such a good place. Like, I don't really, you know, she like actually had moments where like, I have like videos of her like record, like just saying to God, like, I thank God for this cancer. It like made my faith so much stronger. And like, like, sorry, I'm trying not to cry, but like,
I'm trying not to cry.
Yeah, like she was just like such a, like if I even had like half the faith that she has in my life, like that would be incredible. Like she just was such a, and I mean, thank God, and he got to meet her too. But yeah, she was so positive about the whole thing. So I just wish we were able to get her some of like the alternative therapies sooner, because there's people that have been cured of just by taking like ivermectin. Like, I mean, I'm not going to say cured, but like whatever, you know, there's other alternative things that we can take, you know?
Well, thank you for sharing her story. And it's certainly inspirational. And I've got the chills over here just hearing it. So glad we could take a minute and honor her and her memory.
I appreciate it.
So taking into consideration what you guys experienced with COVID, what you experienced with, you know, your mom, and her treatment and lack of detection early on. How does that play into the practice today, right? And how you guys approach patients? I mean, I imagine it's got to be extremely impactful, right? Like you saw firsthand kind of what the alternative looks like, where everybody is, I don't say a number, but you're a patient chart number, right? And you're one of thousands of people they see in a hospital sees in a day or whoever. So you guys are going in the opposite direction. What does that look like?
So just to give you an example, like I had a patient come in the other day. It was a mom who brought her daughter, And she sent me her x-rays like previous, and she's just like, I just want a second opinion. Like the dentist is telling me she needs 5 root canals, and like, I just don't get it. And as soon as I saw her x-rays, she was 16. And I literally called him right away, and I was like, this girl is a mouth breather, 100%. And then she comes in, like, that was just my first instinct. She comes in, she's tall, she's an athlete. And so then I start asking her about her sleep, and she's like, yeah, I don't really sleep well. And then I started seeing like just like her disposition, like her chin was like super strained to like close her mouth. So she's mouth breathing at night. That's the reason she had so many fillings in her mouth already. Like she's already had like 20 fillings.
Wow.
Like up until now, like she's like,
and needs some replaced already.
Wow.
Yeah, the mom was like, every time we go to the dentist, she just like, they always tell her she needs new fillings and this and this and that. And I'm like, has anyone ever told you that she's a mouth breather? And then she's like, no one ever said that that was a problem. And I'm like, started asking her like all these questions. And I'm like, does she toss and turn when she's sleeping? Does she wake up? Was she a bedwetter? Was she all of these things? And then she pretty much said yes to everything that I said. And I'm like, you're literally like starving yourself of oxygen every night, and your mouth is fully dry at night. So that's why you're getting all this decay.
That's what I was going to ask. Yes, the dry mouth at night is what's causing additional. Wow.
And then she's like, well, why has no one ever told me this? And I was like, well, that's not how we're trained. We're just trained to fix the problem. We're not trained to try to figure out why there's the problem, you know? And so I was just like, so happy that she found me at that moment, because at least she's still young and we can try to help her. But this girl is going to have a ton of work in her future, just because fillings last, but they only last a certain amount of time. And when you have such large fillings like that on your teeth, like you're just going to need more extensive work. She can probably keep her teeth for the rest of her life, but she's just going to need work in the future.
Wow.
And it just sucks that like no one ever mentioned that this was a problem. She had so many signs and symptoms. Like even a 10-year-old could notice that she's mouth breathing, or it's like she's straining to keep her mouth closed.
Yeah. Interesting. I've been fortunate that I've had pretty low maintenance teeth my whole life, but I'm definitely a mouth breather too. So now I'm worried about it. I'm not going to think about it. Another thing to consider. So let's take a step back and go into the transition you guys are currently in. You've been married for
4 years.
4 years. Okay. Plans to have kids at some point? Great.
Yeah.
So walk me through the nebulous that is your guys' personal lives, the practice. I understand firsthand, opened a couple businesses with my wife of all that goes into that. So walk me through where you guys are at, the transition you're going through, the thought of kids, like how does it all play together? What have the challenges been?
So we're in month 3 of opening our office in downtown.
You guys are in the thick of it.
Yeah. We were told like the first year is going to be, roughish, and hopefully like if you do things right, it just gets a little bit better, month after month after that. But like I said before, thankfully, like each month has built on the last one, and it's slowly building. So I have no complaints. I'm still working full time at another job in PGA, and that's just kind of to support ourselves and the office while it gets going. So she's there much more often than I am, but I think it's been a big blessing having her there, just to keep the office open, be there. She's also a lot better at admin than I am, so organizational stuff is definitely not my strong suit. But it's been good because I can when I'm not there, I'm almost like I can see things from a bird's eye view as she's telling me, and I can kind of help make decisions clinically, and also kind of how to delegate.
Yeah.
I'm good at delegating, like what I think everyone should do. And she's good at organizing and making it a thing. As far as that, like I said before, also I'm just waiting for the time when it's busy enough that I can just leave my other associateship and be here and at our office full time.
So what's been the biggest challenge so far? Personal, professional, making this transition. I know you guys are still fairly early on, and unfortunately the challenges probably aren't over yet. Yeah. But what have you guys seen so far that's really sticks out, and how have you overcome it?
You mean like during the build out process or after it's done?
Any of it. Like what's been the hardest thing for you guys? Let's stick it personally, right? Like I understand again the strains that it can have on a marriage, on a family, owning a business with your spouse. Like how have you guys navigated that?
I think like just transitioning between like husband and wife moments and then business partner moments, and then just like trying to figure out like when are like stuff that the little things that like give us joy, like we can fit those in, like being able to go to the gym, or like just like getting like moments to like go like
Sunday walk.
our Sunday walk, or like go and just like hang out with friends, like just kind of squeezing, because we've been like seeing patients on the weekend. Like we're staying there some days till like 9:30 p.m. So like when am I cooking dinner? Like I'm probably not cooking dinner, or like I can't eat anything like that late, So it's like, it just kind of, I think the biggest challenge has been like figuring out the schedule that works out for us best to like still be able to like have those little moments where we feel normal and like we're not like so stressed running a business, I would say.
Yeah.
At least that's been like the biggest challenge for me. But I feel like we knew we'd work well together, because we did a lot of stuff in dental school together, like seeing our first patients, like me assisting him, him assisting me.
Oh, cool.
I was like the first filling he ever did in dental school, and
How'd
then
he do?
he was my last one.
How'd
He
he
did
do?
great,
Yeah,
and it's still there, so it's good.
Good.
Yeah,
And I was
no.
the last filling she did in dental school.
No way.
Yeah.
Oh,
Yeah.
that's hilarious. That's great.
Yeah, so we just always like worked really well together. Our personalities, I'm very strong-headed, like I'm very stubborn and very loud and very Egyptian, and he's very like Arab as well. Like he's Lebanese, but he's also just like my calm and like my chill, and like I could be like freaking out, and he's just like, it's fine, everything's gonna be great, and I'm like, okay.
No, it's
So
not.
like he's like the perfect match for me, and I don't know, hopefully he feels the same.
Yes,
great.
Yes. Yeah.
That's awesome. From the outside looking in, right? Like you guys are an attractive couple, you're doctors, you're entrepreneurs, like everybody looking in from the outside is probably like, wow, these guys are just absolutely killing it. What sacrifices don't people see that you guys have made to get where you are?
Probably everything. Time, a lot of monetary investment. I would say even to a degree our own physical health. Just because of the stress of going through school, the stress of each time you see a patient, like you're responsible for every outcome. Like whether it sucks because you're not really, it's hard to be on top of everybody's biology, but at least for me, I do take my work home and I think about every procedure I do that day, and that kind of, I think, can slowly erode you if you let it.
100%.
That's something I've been kind of working on doing less of as much as I can, as long as I know I've done the best I can with the best judgment I can. Also, I think people don't see is the sleepless nights of studying back in the day. The nights us talking, are we making the right decision? Should we really do a startup? Should we really just buy someone's office, have a book of patients, and have a little bit more of a head start in opening this? Also, like if we're now managing staff, we're now responsible for other people's income in this office. So
Stressful.
Stressful.
Yeah.
Making sure they're happy. Like our goal of ours for anyone who works with us is to make it a good environment. We want
Love that.
them to look forward to coming to work the same way we want our patients to look forward to coming to see us. And I think, we haven't been open long. I think we've been doing a good job at both. We're very happy with the staff we have right now, and honestly, every patient we had has been amazing. Like I don't think we've heard "I hate coming to the dentist" once since we've opened,
Yeah.
and we want to keep that. Keep it.
When
that
you
way.
walk in the space, and I said this in the intro, like when you walk in the space, you're instantly like, this is not the same. This is not the, white walls with gray something like gray accents and like very, like 1990s, early 2000s. Like it's beautiful. I mean, it feels like a spa. We kind of went for the same thing in our practice. So I loved it when I walked in. Yeah. And just the entire time you feel like you're going to have a spa day, which is awesome. And I think patients will really enjoy that. I want to go back to what you said about sacrificing your health. Right? I feel that at my core. I don't think people realize the physical toll that owning your own business can take on you, unless they've been through it themselves.
Sure.
You want to talk to me more about that, either of you guys?
Yeah. Like just what he was saying, like the sacrifice of like getting to this point of becoming a doctor and like having all this responsibility. Like we sacrificed our whole 20s to be in school. Like I was just studying all of like the 20s were just studying and then dealing with like my mom's stuff. So it's a ton of stress. And especially when you're somebody that's a perfectionist and you want everything to go exactly as planned, obviously we can only do our best, right? We only have control of certain things. So I would say, just like with the stress and like even like my health definitely declined a little bit. hadn't seen like functional medicine or anything like prior to this, kind of like once we started our practice, and then, you know, my mom's journey. So I started like seeing a homeopath, and she kind of helped me deal with, I had like a chronic acid reflux, like after my mom passed away, and I just could not get it to go away, like for anything. Like I even took like omeprazole just to like get through the, like that little hump. Nothing was working. And then she gave me like some remedies for like grief and stress and all this stuff. And like, I started feeling so much better. I was like, wow, this is so cool. Like, and all these things, like you can take them together and they don't create any side effects. And I was like, why doesn't everyone do this? You know? And then I started having other issues like later on, like starting now to like where it like really started hitting me when my mom passed away and all that stuff. So I've always dealt with stomach issues and just like trying to figure out why like this thing hurts or whatever. And I think it wasn't until I started to realize like how much stress impacted me, because I am like the kind of person that like if I feel that anyone's like even a little bit upset at me, like my stomach instantly starts hurting, like
super empath
right away. I'm like super empath. I absorb everyone's feelings. So if you have good energy, great, because I love to be around you.
Yeah.
If you have bad energy, please stay away from me, because I will absorb it. And it's just like
My wife's the same way.
yeah. It's like a blessing and a curse for
It
sure.
is. It makes you fantastic at what you do.
Yeah.
Right? But then also it's like you also absorb all that energy and the social output that you're constantly under, of like, look at however many patients you see in a day. Like it's, you love your patients, but everyone, it's like almost takes a little bit from you. And by the end of the day, you guys get home.
Yeah.
And it's like, well, I'm exhausted.
Yeah.
So we're not talking right now, but yeah.
One thing, I don't know, I wouldn't say it's unique to dentistry, but it definitely is something a lot of dentists can relate to, is the mental shift you have to do room to room. Like, for example, I'll be knee deep in like a really tough extraction where the tooth's not budging, blood everywhere, whatever. I take a break and I have to go do a checkup, and I have to be so happy and upbeat and kind of put on this air that whatever happened in the other room didn't happen at all. And you do that up to 30 times a day, like different. That's draining on its own.
Big time.
You know, especially if you're unable to regulate it. You feel like you're 16 different people in the same day. So that's also probably a stress most people don't.
Yeah, and it's interesting, and we experience this in the gym. But what clients, patients don't realize is that while you are one of one interaction for them in a day, they're one of 30, one of 50. You know, in the gym, we'd see 100 people a day, and everyone, like, again, love them to death, but it's like the conversation, you just, each time it's like a little bit of your social battery just drain. And then by the time you're gone, it's like, all right, I got nothing left, you know? So when thinking about your guys' practice, right, brand new, you obviously had a vision for that practice and you wanted it to be different. I do not have the sense walking into your office, speaking to you guys, you're like, hey, we just want to open another, dental practice. It's like every other one in the county, one of the hundreds, right? So talk to me about the vision and what you guys are trying to build. Like, what's the ultimate goal, and how do you want to differentiate yourselves?
We want to be a place where people who are already optimizing their health in other avenues may feel like there's a missing link. Like, what could it be that they come to, and hopefully they find one of those solutions. A big thing I've noticed in our practice since we've opened is I've been reviewing a lot of sleep tests, and I'm happy for that because patients are actually listening and doing sleep tests like I'm asking. I don't know if it's just the presence of the office or how much we talk about how sleep affects the rest of the body, and how dentists are like actually one of the premier providers who can see signs of issues with your sleep. But I want to be a practice where we integrate the total body health by looking at what signs your mouth is showing us when we take a look, or how your physical presentation looks. How do you walk? How do you breathe? What's the face shape that you have? How did that get affected by your development? Looking a lot more deep than just teeth, and do you have cavities? Do you have inflammation in your gums? Why is it happening? Is there a way we can collaborate with other doctors that you're already seeing? Do we need to have other doctors come in and be part of your health journey? We want to be like, not a quarterback, but a team player in the patient's optimization of health already.
I love that. Anything to add?
Yeah, I think it's just really like I'd love to see a patient help them realize why they're having certain issues, and then give them the tools to kind of be like, you really actually never have to see me again, because now you have all the tools. Like, if you actually ate the right diet, if you actually optimized your sleep, if you actually didn't have like a ton of health issues that, you couldn't control going on, you probably really wouldn't have to see a dentist, because if you're eating the right foods, you're not eating processed foods. I mean, we didn't brush our teeth back in, 200 years ago.
Yeah.
Nobody had toothpaste. Like, we didn't do those things, but people had their teeth.
Yeah.
So, because the diets that they were exposed to were so different than what we're exposed to now.
Yeah, the body naturally took care of it.
Yeah,
Right?
yeah. We didn't have to do all this maintenance and like go to the dentist every 6 months and like do all these things. I mean, I'm happy to have my profession, but also it's like, if we gave people the tools that they needed, they wouldn't really need to ever see us again.
This is an interesting point you bring up, right? I think that's probably true for most of healthcare, right? Like, yes, maybe we're doing things that are curing disease in some case, and things that would have killed us 500 years ago don't kill us today. But it almost seems like a lot of the lifestyle and things that we're exposed to from a young age are the reason that most of healthcare exists. Does that seem to be true in dentistry as well?
Yeah.
One side of the office that I want to build that I didn't think I would put a lot of effort to, but it's something that kind of tied everything together, is the pediatric side of our office. I don't typically see a lot of kids, it's more her, but I do like identifying issues that I may see in a child that would cause an issue as an adult. So basically what I'm doing is, if I see a kid, I see something that needs to be intercepted, I'm preventing them from needing to come see me as an adult. If there's a airway issue, a really bad tongue tie or a lip tie, something that would need a lot of work as they got older. And a lot of times it's too late, because these patients have really messed up physiologies by the time they get to adulthood, and it's causing an issue enough where there needs to be an intervention as an adult. So that's something that's become kind of a side passion in the office, is building that. So it's act now during an earlier time in life, intercept it before you need to come see me for something major later. So
We have that conversation all the time, right? It's like one of my guests last time was using the car analogy, right? It's like the preventive maintenance is, costs you $100, or you wait until something breaks down, it's thousands of dollars. And it's just, we as a species, just for whatever reason, like to wait until something breaks instead of being preventive about it. So what advice would you give to somebody who doesn't prioritize preventive dental care?
And they want to, or they don't have a need.
No, maybe they just don't. Like, why should they?
Okay.
Right?
So the way I look at it, your mouth, your oral system is the gateway to two things. The alignment of your jaw can guide the alignment of the rest of your spine downstream. So if you have a bad alignment of your jaw, it can affect the cervical spine, which then affects the thoracic and lumbar and all this. So if you have a jaw development problem, airway issue, it's affecting you in way, even if you're not in pain, your body's compensation is causing some kind of dysfunction, and it may not catch up until much later in life. The other thing the mouth is, it's the first part of our digestion. We need food to live. We chew, and our digestion of sugars and carbs begins in the mouth. If you don't have proper oral health, you can't break down things as well, and that's, again, leads it all downstream, which can affect digestion, which then affects the whole body as a whole. Those are the two things. And it's way beyond brushing your teeth and flossing. It's eating the right things and growing up without these environmental stressors, if we can prevent them.
I love that, because it's easy to, and I think most of dentistry focuses on the cosmetic aspect, like brush your teeth, floss your teeth so they look nice, you don't have cavities, right?
Yeah.
But you guys are taking it so much further, and that's incredible.
Yeah.
We saliva test every patient. We check nitric oxide. So that's another big thing, because that'll tell us how well you can breathe through your nose or not. And then, I mean, you said you had a deviated septum or something?
Mouth breathing.
Mouth breathing. Okay.
Oh,
so
big time, yeah.
there may be some kind of obstruction up there that may be preventing you from getting nitric oxide, because we make nitric oxide only in our nose, not in our mouth.
Yeah, I've already got a note in my head to come see you guys next week. I'm like, all right, how soon can I get in there and start attacking this? Yeah. Yeah, because it's funny, talk about the cervical alignment. Like, I have neck issues, and I'm definitely a mouth breather. It's like, oh, maybe I wonder how this is all tied together. Really
I think once you explain it to patients that way, it really does make sense, because it's very rare we'll go through this explanation and someone doesn't get it. They'll be like, this makes so much sense. Why wasn't I told this before?
That's the question, right? Like, why aren't I've never heard this. I've seen tons of great dentists in my life. They're all fantastic,
sure.
but like, why isn't anybody else talking about this?
We're just not taught this in school. Like it's just like you're kind of taught to drill, fill, and bill. That's just what like our training is. It's literally like, how do you fix the tooth? But it's not why it's happening. Like in school, there's sometimes if you grind your teeth, like grind and clench, you get these like lesions. Of course, your teeth look worn, but you'll get like these little like abfractive lesions like in the top part of your tooth.
It'll look like recession. It'll look
like a little
cave.
like cave inside your tooth, and they're like, well, that's from brushing your teeth very hard. Like I was literally taught that in school, and it's like, okay, I believed it because they were telling me they're the professionals, right? And then you come out of school and you're just like, you start thinking about things, and you're like, if I took my femur out of my leg and I took a soft toothbrush and started brushing it, am I really going to wear anything down? No.
It's going to take you a while.
It's going to take a while. We're going to be here forever.
Yeah.
So how does it make sense that taking a soft toothbrush is going to wear that much? And why wouldn't it wear the rest of your teeth away? Why is it only right there? It doesn't make sense.
Interesting.
And so it's basically from that constant friction of grinding and clenching where like your tooth keeps going like this at the root and like against the bone, and it keeps just like knocking some of the tooth away. And then when you think about that, you're like, oh, that makes so much more sense. Like that as opposed to taking like a soft toothbrush and just like brushing your teeth. It makes no sense.
To add to that, I also think it also depends what postgraduate education route you take. Like, because most dental schools are fairly similar, and I understand. Like, there's only 4 years. You have to teach students not to kill patients, be able to do certain basics. So I'm not totally blaming schools for that. I think they could do a better job of this education. But like for me, my first full-time job in DC, I worked with a doctor who I still model a lot of what I do after, how he looked at the mouth with the jaw alignment, fixing big comprehensive issues, looking at the mouth as a whole. So he encouraged, like, if you want to work for me and stay here, you need to go through this curriculum. He helped me finance it, and it kind of totally changed the way I saw the mouth. So I think sometimes there's a little bit of luck in it, depend if the student or the new dentist doesn't have an interest in any of this already. If they land in a certain core curriculum, that kind of opens their mind, and then they start seeing it in patients that they missed before. I think that kind of is how you go down the rabbit hole that way. That's what happened with me, and I guess it's a similar story with her going down the biologics.
Yeah, it sounds like a blessing for both. You just kind of happen to land in the right place. And kudos to you guys for recognizing, like, wait, there's a better way to do what we're doing and not being fixated and like has to be this old school way. I want to ask you, you said drill, fill, and bill, right? I like that. That's fun. Never heard that before. In dental school, would that be the equivalent of what I perceive in modern like medical school of like sick care, prescribe a medication for everything? Is that kind of a similar?
It's exactly the same model, I would say. So with medical schools, because a lot of like big insurance companies will like support medical, or not insurance companies, like big pharma will kind of like push the curriculum in medical schools because they're just trained to like, oh, this person has acid reflux, put them on omeprazole or famotidine or some other acid reducing medication, not thinking about the downstream effect that that's going to have in the future. And then it's the same with dentistry. So it's like, okay, this person has a cavity, fill it, and then bill the insurance and, go on to the next patient. And it's like, okay, like, great, that's great. Like, we're still helping somebody. You're still taking somebody out of pain. Like, what really attracted me about dentistry was somebody could come to my room or, to my chair, and I could fix their problem right now, here and now, here, like at this moment. So, and I've had patients where like, oh yeah, that tooth was really bothering me. I'll check on them 3 hours later after the numbness wears off, and they're completely out of pain now. So there is like good parts about dentistry, like don't get me wrong, and like the way we're trained, but yeah, the drill, fill, and bill model is just not really what we're going for. We could see like 4 patients a day, and that's like more than enough in our office because we're spending like so much time with them. So we can't do the drill, fill, and we're not doing the drill, fill, and bill model, so we can spend that time and like educate the patients. And after every appointment, when a patient comes, we send them like a big follow-up email, like a really long email explaining everything that happened in the appointment, any findings we found, like, and it's just like patients are like so appreciative because they're just like, no one's ever done that. And I'm like, well, this should be the standard. Like, so you actually understand what you need and the tools that you can use to better yourself.
Why do you think it is the standard?
Because
Time.
yeah.
Just it's just the time allotted that patients have, and truthfully, part of the, if I'm being honest, it's the economics of it. Insurance companies, I don't know how it is in medical, but dental, it's they've slowly cut reimbursements. The price of things gone up. I mean, the dentist as a business owner has to kind of still make ends meet. So they kind of have to see more patients, which is less time per patient, which is less time per education, and that's really how it is. It's nearly impossible to maintain that much higher volume and maintain the quality in education. I couldn't do it. That's why I needed to slow down and see less people per hour, so I could talk about the things I
love that.
You know.
And it's exactly why we're in the space that we are. We're not building insurance in our business. And I think that a lot of times people perceive cash pay dentistry, concierge medicine, longevity clinics that don't accept insurance as maybe being greedy or selfish, but people need to realize, like, you guys have a living to make, right? You got a beautiful office you got to pay for, you have staff you have to support. And in order to provide a higher level of care and really spend time, like insurance just isn't cutting it anymore.
No, there was like a little thing, because like when the Knicks won, they hadn't won in like 53 years or whatever. And Delta Dental, I guess, was one of like the first insurance companies that ever came out. So 53 years ago, when the Knicks last won, Delta Dental gave $1,500 to patients for the year.
As a max.
So we're still giving $1,500 now, 53 years later. And I think the stat was like, there's like a 632% inflation since then.
Yeah.
So like the cost of doing a filling 50 years ago is not the same cost of doing a filling now.
I mean, what does that come out to? Like the equivalent of $250 today?
Yeah, it's
Like
probably less, honestly.
Yeah.
I don't know.
Or that would be $250 53 years ago. Like, it's just not
Ridiculous.
sufficient to, it's insane.
Do you face that too in your space with the whole insurance
So
thing?
on the imaging side, we do.
Yeah.
Where, we do insurance, health insurance, and even personal injury, automobile insurance. Both of them is constant downward pricing pressure. Right. A lot of the healthcare stuff, like, we don't really make money on healthcare scans. It's really just to keep our doctors happy that are referring in patients and referring in cash pay and personal injury stuff. Like, that's really the only reason we see those patients. I mean, of course, we want to treat the patient and take care of them, but talking strictly business, like, it doesn't do anything for us other than maintain a good relationship. And it's prevalent across our industry. And like, I even think about when my old primary care physician started up his own practice 20 years ago. And at the time I was seeing him, right? And it was great early on. Then as he grew, insurance reimbursements got less and less, like, started noticing nurse practitioners. Then I wouldn't see him, see the nurse practitioner. At first it was like half an hour, then it was like 20 minutes, then it was like 10 minutes. And and out, like, all fantastic people, all want to do great by their patients, but they're locked into that insurance model, and it's got to be volume based. I mean, they must have had, last time I went was 3 or 4 years ago, they must have had, I don't know, 20 people in the office, 30 people in the office, staff. And it's just go all day long. It's the only way they can be profitable. So got a few more minutes here. So we got to kind of get towards the end. If someone had never been to Aura.
See how it works together.
I'm wondering if that's intentional now. Been into Aura, right? And came in first time. What do you want them to leave with?
Information, at the very least. Even they learn something about their mouth or why a certain thing is happening that they didn't know before. A few patients that have come to see us have had chronic headaches and went to neurology and had MRIs and saw 16 different doctors. And really what the issue was is the muscles were overactive because the bite alignment was off. And once I took photos, showed them, even had them like touch their own muscles when they did different jaw movements, they realize, oh my God, like, I'm holding all this tension here. That's one example. But really the educational piece is really important for us to impart on patients. And we do think that the experience of being a patient of ours is a little bit above what they're probably used to. But more importantly, it's what do they know leaving our office about themselves and their health that they didn't before.
I love
That's
that.
that's what I can say for me.
Anything else?
Yeah, just like simply like just like the little tests that we do, like testing nitric oxide. And then I like, of course, I do like our medical history and like all the forms or whatever. It's like 20, almost 20 pages long. So like patients definitely complain about that. But I'm like, listen, like I'm trying to like learn everything about you so I can give you all the information that I feel like you need. So simply testing nitric oxide, right? Like that's a marker of your cardiovascular health, inflammation. And so they might be on high blood pressure medication because they're a mouth breather, because they're not producing nitric oxide. And then they're just like, oh my God, no one's ever told me that. And I'm like, I'm not saying that I'm a cardiologist and I'm diagnosing you, but also this could be contributing to this, you know.
Worth taking a look.
It's worth taking a look for sure. If you maybe correct your nasal breathing, then maybe you won't have to be on your blood pressure medication anymore, you know. So it's just like finding those little things in their health history and their mouth that maybe I could help them reduce a medication or like just get healthier overall.
Love it. Over the last decade, because if my timeline's correct, you guys started dental school about 10 years.
2015. Yeah.
2015. Okay,
Yeah.
yeah, so 12 years ago.
Yeah, exactly.
So over the last decade, right, what have you changed your mind about in dentistry? What's been the big shift going from where you were in dental school to now having your own practice? What's been the big shift for you guys in terms of what you believe?
I would say for me, and probably a little bit for you too, is, well, for me, I was going to say fluoride, but maybe you can talk about that with like the pineal gland stuff. No?
What do you mean? Like changing our opinion on fluoride?
Yeah, like.
Yeah, so we're a fluoride-free office. The vast majority of biologic health and wellness-based offices are going to be fluoride-free. One thing that I learned this from the doctor I used to work for in DC. He showed CBCT is a 3D X-ray that captures, depending on the field of view you choose, the jaws, the teeth, parts of the head above and below. So I'm like learning from him. He's going through looking through a CT, and he was like, "What's this white dot in the middle of the head?" I'm like, "I don't know." He was like, "Well, there's a gland in the middle of the brain." And it produces melatonin, which helps you sleep. I was like, "Oh, it's the pineal gland." He was like, "Yeah, it's a gland is a soft tissue. Why is it showing up white, like on this CT?" I'm like, "Is it a tumor?" He was like, "No. This patient came to us complaining of bad sleep, had not overdosed, but had been exposed to so much fluoride in their life that it calcified that. So now they need to take melatonin to sleep and they need so much correcting in this." So that could really open my eyes to the poison that fluoride can be to our body. Because like you said, there's no way to really store it, fluoride. So somehow companies made it so that it put it into our trays. And to be fair, it does prevent cavities and decalcification, but you're getting those because you don't have a fluoride deficiency. You have some other mineral that's causing these things to happen, and it can be fixed other ways.
Or like mouth breathing or, you know, all these different things that can contribute to why somebody has cavities. And then for me, I would say like in school, we're taught like the safety of amalgam fillings. And it's like, and in school, you're even taught to call them silver fillings. So it sounds like a little bit more appealing, but it's really a mercury filling. And so, because it's
50% mercury. Yeah.
Yeah.
Which is toxic.
Which is
Yeah.
very
Super
toxic.
Yeah.
Like in, you know, like the old school thermometers, there was mercury in there. And if you broke it, like,
Don't touch it.
yeah, don't touch it.
Don't touch it.
So why is it safe to put in our mouths? And then when you remove it, you have to have an amalgam separator. So it doesn't
any
go
office, traditional office, not biologic, the same, you know.
So it doesn't go into the water. And then, because if you do, then you get an EPA violation. And it's like, well, why is it safe to put in our bodies?
But not in the water.
Yeah. And then when I got my like own functional testing done, I was super high in mercury. And it's not like I'm like consuming tons of fish. Like we rarely eat fish. We're like chicken and meat more so. And so why am I high in mercury? Probably because I'm removing it all day, not safe breathing it in. And it's still in my body. Like I've been detoxing from it, and it's probably created a lot of the inflammation that I've been dealing with and all these other issues. So it's like, well, why is this safe for people to have in their mouths?
Love that.
Yeah.
Well, guys, thank you so much for being on. It was really cool to learn about the practice. We're going to do it again sometime in the not too distant future. Before we get off, want to tell people how they can find you guys?
Yeah. So we're on Instagram, Aura Dental and Wellness. Also our website, auradentalwellness.com. Check us out. We post several times a week. So there's definitely something that anyone can find interesting in the weekly posts that we do. You can also give our office a call, 561-299-5852. We'd be happy to, and we look forward to meeting you and answering any questions and helping you guys optimize your oral health.
Awesome. Thank you guys for being here.
Thanks for
Thank
having
you.
us.